Alright, so welcome to my presentation on my preceptorship at Better Lives Animal Hospital. Where was I? For all of my 240 hours, I worked at a clinic called Better Lives Animal Hospital. I can actually remember when this clinic opened up back in 2016 in a small town only a few minutes away from my house. They're a small clinic, and they're located at 7302 South Broadway, Red Hook, New York. When they first started out, they were unsure of how this would pan out. The husband and wife duo, Dr. Edward DeCourt and Kathleen Berger, wanted to get out of their previous large assembly line type of clinic to start anew. Lucky enough, they found this wonderful, homey spot that had previously been a clinic and had a lot of stuff from the old clinic that the owner just left. This included patient records. Needless to say, all of that helped them start up, from not having to buy as much equipment to calling all of those old clients to make them aware that they had their animals' records. A lot of people were very thankful to receive these records. Some went on their way to wherever they went after Whalesback, the previous clinic, closed. Others stopped in to check it out and see what was happening, and even hopped on board. My mentor, Danielle Jordan, the head tech at Better Lives Animal Hospital, also works at the same clinic Dr. DeCourt did. They were friends, actually. She was gung-ho for the couple's idea, but didn't follow along with them immediately as she has kids to care for, and didn't want to drop everything and risk her income. But as soon as she saw business starting to boom, she hopped on board as well as part-time tech Brittany. Along the way, Linda also joined as a part-time tech and our resident cat rehabilitator. What's it look like? So here you can see the lobby where the clients and their furry family members wait for Dr. DeCourt or Danielle to call them in. Also, you can see its very homey vibe, which is usually how new clients describe the area. The big stone wall houses Kathleen and everything she needs to run the clinic. She is our hospital manager and handles almost all of the appointment setups, creating statements and billing payments, and buying things that we need, and so much more to make sure the clinic is running as smoothly as possible. We also have our sweet Baba, Kathleen's dog, but also the clinic's dog. He's a very sweet miniature poodle puppy with a cerebellar hyperplasia. He tries so hard to play around with some of the other clients' dogs and our shoelaces and pens, but his balance is so poor and he's so shaky he just can't. He's just such a sweetheart. This is where all the action takes place. This is the exam room, which there's not too much to explain about the room. We have a fridge for bulk vaccines and certain antibiotics and medications that are also, it also houses our out-of-house blood samples and fecal samples. The drawers, aside from everything on top of it, hold muzzles and needles, syringes, blood tubes, and so on. There are also some medications and vitamins in there, like our cure-all when it comes to fluid therapy, B12. There's a computer for quick lookups, checking appointments, and even to make rough estimates for clients looking to know what a procedure might cost. And of course, we have our dog and cat treats on top of the fridge. There's also some catnip up there, but it's a secret. So this is a treatment room. Quite honestly, not a lot of treatment happens here. The door to this is connected to the exam room and is labeled treatment room, but generally everything is still done in the exam room. In here you can't see the drug shelf, but it's actually behind me in this picture. There are all of our non-controlled substance drugs up there and are labeled in a very understandable order. They're mostly in alphabetical order, but there are some different sections for things like cardiac drugs, allergies, NSAIDs, ear, nose, and eyes, as well as dewormers. We also have an automatic pill counter too, which didn't even cross my mind of existing, but it's so handy when you need to have like a lot of drugs dispensed, like doxycycline for a large dog positive with Lyme. In the picture, you can see our wet table, which is where we have emergency animals generally, as well as our centrifuge and x-ray machine. We also use the wet table for grooming, which works very well for bigger dogs since it's very deep. And the big white door, which is open right now, is where the x-ray machine actually is. And it's kind of like ours at the school, where it's like an old machine, but it's been modified so that things aren't like the x-rays aren't printed out, they come up on that computer right there. And welcome to the basement. This is where we spend most of our time when we don't have clients. This is where our in-house CBC, Chem, and UA machines are. All are run through IDEXX, which is also responsible for our scheduling system. As you see, there's another exam table, as well as some more storage. Down here we have a bigger variety of needles and syringes. It also is the place where we store other necessities like vet wrap, gauze, cotton balls, alcohol, and so on. We also have some holding cages, the topmost we use as storage for blankets and surgery, like sterile gloves and all that. Um, but the bottom two levels are where we house dogs and cats before and after surgery, or if they have to be boarded overnight or to be kept to watch for some reason. Generally, we don't board animals, but in certain situations we can watch them for a few days if need be. Another thing about the cages is that we have a squeeze cage, in which in my time here we've only used once, and I had no idea beforehand what it was for. Even Danielle, who's been in the field for about 20 years, had never seen one until this clinic. It's basically a normal cage, but has another door with handles on the outside of the cage that you can use to decrease the cage space or squeeze a fractious or feral cat against the front door to help sedate them without having to get into the cage. It's super handy since we get a lot of feral cats for spay and neuter since Linda and her affiliation with the Itty Bitty Committee, which is another local cat rescue.
Okay, so this machine I'm going to need is still turning on, but we're going to do Christina. She's going to get a Chem 17, and then we're going to do a CBC. So to run it, I just do this, press run, click the machines that I want, which I want this one and that one, then press run. And so now I'm going to grab a Chem 17 clip. Gotta figure out. So I need to repel these. Put these things up here. Ah, dropped it. Got in there. Dispose of these old ones. Swirl this a little before I take off. And I gotta take off the little green tab. Sorry, I gotta put you down. This is really hard to do. I gotta open this. Hold on. This is the Chem 17 clip. And I just put it into the slots, pull back, and that's it. I close it, press that, and then it starts to run. It shows you the time it needs here. Hopefully that'll show up in a second. So here it is. For just a Chem 17 clip, it just takes like a minute and a half about-ish. Usually we do like a Chem 17 and SDMA, which requires another clip. That usually takes like 8 minutes. But we didn't need one SDMA this time, so I'm just gonna wait for that and I'll come back. Alright, so excuse the chem machine, it's very loud. But this is ready, so now all I have to do is click it. We'll come over here, grab the blood, invert it 10 times. And then put it into its little slot, close it, and press start. Simple as that. Sometimes you have to press start run as well on here. Yes, I know, I already did that. Alright, and that's that. Ignore that. So, okay, so for the urinalysis, we're just going to click that, run it, and press this, this, and this. Nope, I pressed the wrong things. Excuse me, that one. Then we're going to click run. And I like to start with using the pH UA strip. Just a drop or so on each. Some of them don't like to spread out immediately, just to soak it. We also have these like special pipette tips for our syringes, especially for this. And then we put it up into this, and it goes in, and then put it into the, can't really see, but there's like a little hole in there in the cartridge, and you just fill up the cartridge until it gets to like this little squiggly line. And then press the go button, and then come up here for the specific gravity. Open it up. It's going to be a little hard to do with one hand. Put the drop on, close it, and look into it, into the light, and the specific gravity is 1.024. I don't think I can get that to, oh, maybe I can. Kind of. Right there. Very hard, but now that that's in, we come over here, we click this, and it was a free catch. The color looks a little different on camera, but it's pretty straw colored and clear. And then we put in 1.024 and save it. Yeah, and so then we wait for everything to go through. This will be done in like, actually it's done now, and then we wait for that.
So this is a self-explanatory room. This is where all of our surgical procedures take place. There's a sink for scrubbing, 2 rolling tables to hold Dr. DeCourt's equipment during surgery. We have a small autoclave, as well as a large table to accommodate all animal sizes. As you can see, the table also stores, when not in use, equipment that needs to be packed for the autoclave. And since Danielle is a Delhi graduate, she wraps packs the same way I was taught. So, let's get to know everyone. This being a small mom and pop type clinic, we only have one vet, Dr. Edward DeCourt. He is originally from New Jersey, and while I don't know what or where he got his undergrad degree, he does talk about where he got his DVM and his experiences there all the time. Dr. DeCourt actually went abroad for his degree to St. Kitts at a school called Ross University of Veterinary Medicine. In his years, he's worked at multiple clinics and dreamed of opening his own. Most notably, he worked at the Kingston Animal Hospital, where he and his wife were not so happy towards the end of their time. While the place had not been corporatized, the way that the clinic was ran had drastically changed, and the care that was given to animals was subpar to his standards. So, when he stumbled upon what is now Better Lives, he jumped on it as quick as possible to start anew and be his own boss and give the type of care that he approved of. Kathleen is the most wonderful woman to work with, so personable, professional, but also sassy and funny all at once. To the naked eye, she's just the receptionist, but she's also our practice manager and does everything she can to make sure we're running smoothly. Have everything we need, make the appointments, send the reminders, and so much more. She too worked with her husband at Kingston Animal Hospital as a practice manager, and even she felt the care of the animals had drastically changed and felt the need to get out. The text. This is my mentor, Danielle. What a sassy lady. She was wonderful to work with, and as much as she said that she was a horrible teacher, she definitely wasn't. Danielle graduated from Delhi years ago when she was in her 20s, and went on to work in many clinics. Her favorite, but least favorite, was an oncology specialty clinic in Newburgh, New York. She loves everything to do with advanced imaging and reading the images and using the diagnostics to go about treatment plans. But at the same time, it was the hardest job for her since she had to see these cancer patients going through chemo and looking like they just wanted to give up, or they had terrible radiation burns from the treatment, and all she could say to the owners was, "You're doing the right thing," so on and so forth. She actually tried to specialize in oncology and advanced imaging, but lack of case studies or the case studies being rejected prevented her from doing so. In the end, she was also at Kingston Animal Hospital for only a few months, where she met Dr. DeCourt and Kathleen. She saw them go off and make their own way, but didn't hop on board with them immediately until business started to pick up at Better Lives. More text. We have Linda Nolan, a she chose veterinary science late in life after her passion for rescuing cats got even more serious. She did the vet program at SUNY ULCER and has been at Better Lives since. Brittany, which I've only worked with her very briefly, she was also working at Kingston Animal Hospital for a short time, and then went to Better Lives, where she could have a more flexible hour choice while she was getting her new degree in human nursing. So, here's my thoughts on my first 20 hours. I worked at this clinic for 10 weeks, the first 5 being my first 120, of course. It was a whole new experience for me. A lot of things were different, and a lot of things I hadn't learned yet at school. So for the most part, it was a lot of learning, and thankfully business was kind of slow, so it gave me plenty of space to learn how the clinic operated and get to know how everyone worked around there. It definitely felt like I was more of a veterinary assistant than a tech in training, but that's alright. I had to start somewhere. In the time there, not only in my first 120 hours, but the second half too, we had many feral kittens come in for feline leukemia virus and feline immunodeficiency virus testing so that they could be domesticated. Since we work with a local cat rescue itty bitty kitty committee and Linda, we always have an influx of kittens and adult cats to treat, spay, and neuter and try to help. My favorite was rehabilitating the kittens. It was so gratifying to see them go from hissy wild cats to loving babies that purr when they're pet and actually want you to be around them. Another big thing I did in the beginning was catheter placement. As soon as Danielle knew that I had only practiced on fake legs, she wanted me to do it on real animals, ASAP. The first time I tried, I ended up blowing one cephalic vein that the pre-anesthetic didn't go in, so I placed it on the second try in the saphenous vein, and from then on out, I was really good at placing them on dogs, but not the best with cats. I can remember there was one cat that we had with such small veins that Danielle, Dr. DeCourt, nor I could get a catheter in. It was definitely crazy. So, we don't do super professional grooming at Better Lives, but we do offer it to clients, especially for those people that have very hairy dogs or small dogs that need their fur trimmed and their saliva staining taken care of. Danielle, before she was a vet tech, was a groomer, and after that showed dogs in AKC competitions. She's very particular about how dogs are groomed and typically likes to set them up as if they were going to be in a show. Due to this, I never really bathed a dog on my own, just assisted as much as I could. Another big thing were dentals. Typically, I only observed the dentals because one, the drill on our dental machine was a little broken, and two, none of us, including me, felt comfortable doing dentals since they all usually involved extractions, and I hadn't taken the class on it yet. Of course, the biggest thing I saw here was vaccines. I was actually able to give some vaccines, generally to the feral cats while they were coming out of the anesthesia from their spay or neuter. We even had some clients refuse to give their animal any vaccine due to causing further illness. One woman even tried to tell us that it was basically bull that you could give the same dose vaccine to a 100-pound Rottweiler and a 10-pound Dachshund. Of course, Dr. DeCourt tried to explain how that worked since he studied that kind of thing in grad school, but she was not having it. Another thing I got to experience was a tech visit. Basically, it was just Danielle and I running the clinic while Dr. DeCourt and Kathleen were away with their kids. It was incredibly slow, with just a sprinkle of quick appointments every hour or so, but we stuck it out until closing time. During this time, Danielle was able to teach me how the scheduling system worked, which is run by IDEXX and was super simple. This time also included how to make billing statements, how to do estimates, and how to cash customers out. I was also able to draw blood from Danielle's cat, Kobe, who needed a FeLV test because, while he had the vaccines, he was attacked by something outside and had a big abscess on his face. It went alright, definitely something I need more practice with, but I got in the vein, drew the blood, and didn't blow the vein, so I was pretty proud. Alright, so here's my first case study. Yes, it involves possum. On my second day at the clinic, 2 possums were dropped off to us for some care while their rehabilitator and good friend of the clinic, Robin, had to go away for work for a few days. Robin has a special place in her heart for rescuing and rehabilitating Possum, so of course she chose trusted friends to take care of the little Joeys. These babies were two different ages, one old enough to have its fur and look like a possum, the other still bald and pinky. Their story isn't too in-depth, but the short of it all is that two other people had had them in their care before they were pawned off to Robin, who welcomed them with open arms to her family. Since Robin has been raising possums for years, she knew exactly what they needed and how to care for them. Unfortunately, these babies were in bad shape and needed a lot more care than usual. Of course, they were both young enough to still be feeding from a mother, but she was gone, so we had to simulate her milk in a nipple. The older Joey was more apt to drink from a small bottle or from a syringe with a nipple tip, but still struggled with it a lot and had to tube feed occasionally. The youngest refused to eat completely, and would even fight the tube feeding and oftentimes aspirate the milk. Robin, of course, educated us on what she was giving them, what it was, and how to make it up and feed it to them. She instructed that they had to be fed every 4 to 5 hours. We did end up having to tube feed both of them at some point, and it was definitely a team effort to do this. The scariest part about it was knowing if we were in the stomach or the lung when tube feeding the Joeys. Luckily on the pinky we could see the milk spot assuring us we were in the stomach, but the older one had fur and was much stronger and fought everything. The ending to this is bittersweet. Unfortunately, the pinky passed away within 2 days, which wasn't a surprise since he was always lethargic, and as we like to say, ADR, or ain't doing right. The older Joey, however, survived to go back with Robin, and to my knowledge 9 weeks later, is still living and doing well. Here you can see the youngest on the left being tube fed and the oldest on the right being syringe fed. Case study 2. The baby squirrel. Again, with the wildlife. We had a young squirrel come in. Not really a baby anymore, but we still called her a baby. Not too much is known about her past, aside from that she was abandoned and a woman ended up adopting her from a rehab center. And I say adopted because the kit had some sort of disability and could not be released back into the wild. We all agreed that she had what seemed to mirror human Down syndrome, but we never had genetic testing done to see what actually was going on. The baby squirrel had abnormally large and drastically almond-shaped eyes, wide-set eyes, wider than normal, a very broad nose bridge, and her body just didn't seem properly developed. Short tail, naturally curled body, and so on. The reason she was brought in to us was that her right eye was much bigger than the left and was very clouded over. This eye apparently had been like this since she was little and has progressively gotten worse. So her owner decided that, to be on the safe side, she wanted to get it removed. No one knew what was going on with it. Dr. DeCourt and Danielle speculated that it could have been some sort of trauma that happened to her before she was found, or glaucoma. Now, there's always a risk when it comes to anesthesia, and the smaller the animal, the higher the risk. The client was aware that there was a high chance of the kit not surviving through the enucleation, but she wanted to go through with it anyway. To sedate her, we used a very small dose of Tilazol. Then we ran into the problem of our smallest ET tube being too big for her. So now it was time to improvise. Of course, Google was our friend, and we ended up making a little tiny cone to connect using a 5 milliliter syringe container and some vet wrap. It wasn't ideal, and everyone felt a little lightheaded since it wasn't the most secure connection, but we pulled through. All in all, the procedure went very well, even with the makeshift cone in the way of the eye a little. We used what we call an eye pack, which is just a sterile pack of tools needed for small, intricate procedures like enucleation. On the far left is me holding the lovable little squirrel. The middle is the wonderful improvised cone, and the right is the eye completely removed. Once done, all was going well. She started to get a little pedal and palpebral reflexes back, and she was stirring a little bit. She was coming out of the anesthetic. But she was getting very cold. So Danielle decided to put a small hair dryer and a towel to warm her up. The hair dryer was hung from a distance so it wasn't a hard blast of air on her, and the towel further diffused the air. Dr. DeCourt came back down to the basement with a reversal of some sorts to help her get up quicker. But suddenly she wasn't breathing anymore. We all panicked. Dr. DeCourt immediately gave her the injection and got to work on CPR, but it was no use. She was already gone. Case study 3. The Miracle Cat. Another one of our clients is dedicated to saving cats and giving them a second chance whether they're feral or not. One of her cats that she has had since he was an older kitten has had many roadblocks and near-death experiences in his life, and she cared for him with much, much more precision, I say, for lack of better words, than the rest of her cats. In my second week, she called frantically saying that Miracle, the cat, had suddenly lost all movement in his rear legs. She was worried he'd thrown a clot, even on his blood thinners. Of course, we told her to come in immediately, but on the car ride in, his owner couldn't hear him breathing. It seemed as though Miracle had met his final match. By the time she arrived with him, he had passed. She wanted to know exactly what had happened since she was so close to him, so she requested a necropsy. A week later, she came back with another one of her cats, and swore up and down that after the cause of death being confirmed, that it was her fault and that she thought that he had gotten into a bucket of cleaner she left unattended while cleaning the house. But we reassured her it wasn't that. It was what we had found. So what happened? As soon as she left, it was a slow period, so we were able to get to the necropsy immediately. Once inside, we could tell something was really wrong. Miracle had blackened spots all over his spleen and lungs, and most notably, an abnormally large amount of pericardial fluid around to the heart. Due to that finding, we decided to start at the heart. We popped the pericardial sac and removed the heart to get inside and see what was going on. Inside, we found our culprit, a huge blood clot lodged between two chambers of the heart, preventing blood flow. Here's the clot. Since there's no real size comparison, the most I can say is that it's about the size of a quarter. It was that big. My last 120 hours is where things started to get real. I saw lots of weird things that I'm sure most people didn't get to see in a small clinic on their preceptorships. From the possums and the squirrel in the first half to two critical hit by car fawns, and even a dragged by car dog, it got real serious real fast. At this point, my techniques became more refined and reliable to the point where it felt as though I was more of a tech in training than an assistant. Danielle started to let me restrain animals in appointments, and I started to become a lot more personable with old and new clients, and I was even taught how to read the CBC and chem results, which I only mildly can understand. So let me tell you a little bit about our ultrasound machine. It wasn't until around my last 5 weeks that we really needed it, and Danielle was very excited to show me how to read an ultrasound. But apparently the machine itself was not excited. Mind you, our machine is pretty old. The first model type was released around 2006. Whether or not ours was that old, we don't know, because it was a hand-me-down to Dr. DeCourt from another vet. So what was happening was that instead of seeing a black and white image, there were yellow and blue hues throughout it that kept moving around, making it very hard to see. And the more we fiddled with it, the worse it got, to the point where the screen just totally gave up and had vertical jumping lines across it, so you couldn't even read anything or even use it at all. Dr. DeCourt tried to get it fixed, but when he brought it down, it worked perfectly fine for them. As soon as he got back to us, it was doing the same old shtick. Then it gets better. The yellow and blue hues were replaced with a more intense red and green hue. It wasn't until my last week that Dr. DeCourt had the time to make the trek down to the repair center, where this time it acted up. All that aside, we did try to use it, and one of the most exciting times for me was when we were doing a preg check. The breeder just wanted to know an estimate on how many puppies his bitches may have had. And while we could definitely make out some puppies with our problematic machine, it was only a guess to how many there actually were. But it was cool to see the little spines of the puppies in there. Of course, summer is hotspot season, so we saw a lot of those. We just scrubbed them with some chlorhexidine and gave antibiotics, and occasionally gave an anti-itch spray. Again, the kittens followed me through until the end of my stay, and we got to care for and rehabilitate them. I was able to further refine my ability to place catheters, and by the end, I'd say I'm an expert on dogs and pretty alright on cats. Case Study 4. The Mystery Ulcer. Mr. Jacob was a regular of mine. Every Friday for almost 10 weeks he came in with his owners for a mysterious ulcer on his left eye. We all chalked it up to some sort of allergen at Grandma's that was causing him to rub his face across the carpet and in turn scratching his eye. To see his ulcer, we used fluorescein dye and a black light to track the size of the ulcer. We also started to treat him with a medicated eye lube and an e-collar to prevent the rubbing of his head across the carpet. This helped a little, but the healing process was very slow. Since we were seeing little change, Dr. DeCourt decided it was time for a new plan. He said, let's put a third eyelid flap in place to further protect the eye from the allergens. It was in place for about 3 weeks, and on the third week was removed. With little improvement. Everyone was stumped at this point. We decided to see if the previous treatment plan helped after this before trying something new. Mrs. Shabbat was hiding a secret from us. She'd only been applying the eye lube once a day instead of twice, but things were starting to look up. At this point, we didn't know if it was the once a day eye lube or the convenient antibiotic injection. So we continued as such since it was working better than the first plan. But then it was good news and bad news. The next week, the day before his appointment, he was a whole new dog. He was paying no attention to his eye and was excited to not have the e-collar on and was running and playing outside like nothing was wrong. And then the day of his appointment, he took a turn for the worst. The ulcer had grown bigger than its original size, and he was in major discomfort again. Well, we decided to try something new this time. Dr. DeCourt drew blood from Jacob to spin down into serum for the Shabbats to put in his eye and continue with the same antibiotic injection. 1 week later, the ulcer was almost 99% healed. We'd finally found the answer. His parents were so relieved, and we're sure Jacob will be thankful that the treatments would be coming to an end. We ended up drawing more blood for serum since they were all going on vacation to the beach, and Jacob just loves to dig in the sand. They wanted to make sure that they had some serum in case his eye got irritated from the flying sand into his eye. Here you can see on the left side is the ulcer the day it was at its worst, and on the right, 1 week later, after the serum treatment. Almost barely there, just a little speck. Case Study 5. The Problematic Paw. Oh, Agatha, my first cancer patient. Before I had come to the clinic, she had come in with pre-cancer on her right front paw. Of course, Dr. DeCourt removed it, but her owner couldn't afford any chemo, so he made sure to get as wide of a margin as he could with what little skin is on the paw. For a while, it seemed like he had gotten perfect margins, but unfortunately, it came back, and with a vengeance. We got her in ASAP to get the mass off before it became a bigger issue. Since the first removal took so much of the skin on her paw already, Dr. DeCourt wasn't sure if he could get the clean and clear margins that he wanted. After starting the surgery, this became more apparent, and we started to get concerned. So, Dr. DeCourt ended up having to try and call Agatha's mother to get permission to amputate a toe to ensure that he got everything this time. Unfortunately, we couldn't get a hold of her, and without her permission, we had to follow the original plan. He pulled through with what he could work with, leaving Agatha with her, as her mom jokes, Frankenpaw, since it looked so crazy from the 2 surgeries. She recovered well and had her pain meds before going home, plus some for the next few days. She had her normal recheck within a week, and everything looked A-OK, and her stitches were removed. Since then, fingers crossed, everything has been fine. Case Study 6. Uncomfortable Bumps. Poor little Norman was the most anxious old pup I've ever seen. He was blind and deaf in his old age, so he didn't ever know where he was or what was going on, causing him to cry out constantly in anxiety. To add on to that, he was covered in lumps and bumps, making him even more uncomfortable. His owner, a young woman who lived in the city that had him since she was little, had her dad bring Norman in, with her on the phone, for a second opinion on what could be done with his warts, cysts, and skin tags. His normal vet advised that he was too old to go under anesthesia for the removal of these uncomfortable bumps, but upon examination, Dr. DeCourt said his heart and lungs were perfect, and that there was no reason that they couldn't go through with this quick procedure. After much reassuring that her childhood pet would be okay during the procedure, we went on for scheduling. Within the next week, Normie was brought in. This time, his owner made the trip to be up with him, and again, we reassured her that he would be perfectly fine. Finally, it came time for Norman to have his surgery, which was a very simple electrocautery removal to remove most of the bumps. As Danielle and I were going through and getting everything ready and him sedated, we noticed him gasping and his heart rate fluctuating badly. We called for Dr. DeCourt, who said to skip the actual anesthesia machine, that it would make everything worse, and that he needed to get it done now before the sedative wore off. We rushed around getting the electrocautery machine ready, a scalpel for the bigger cysts and warts, and a staple gun for quick suturing of some of the removals. Norman recovered well. We kept a very close eye on him and even kept the monitor hooked up to him until he was almost fully awake. Within no time, he was anxiously crying for his mom. Before the surgery, Danielle and I gave him a little bath and grooming to get him looking extra spiffy in his new skin. He went home later that day, and his owner was very relieved that he made it through. A week later, he came back a whole new boy from his recheck. His owner's dad said he was much more comfortable and he was noticeably less anxious. Definitely a whole new dog. All in all, this was the best summer I've had in years. It was definitely stressful working two jobs, one paid and one not, but it was definitely worth it. As Kathleen described, I fit in with their classy, sassy, and sometimes smart-assy staff. Growing up, I always wanted to be a vet, and it never changed, and quite honestly, I couldn't see myself doing anything else but that. However, once I started the schooling, I became nervous that maybe I wasn't cut out for this after all. But after working in a full clinic almost every day for 10 weeks has definitely shown me that yes, this is what I'm really made to do for life. This is my passion. I'm made for this. Sure, I need more practice and more experience, but I loved every second of it. And it even convinced me to enroll in the 4-year program, which I was on the fence about doing. In the end, Dr. DeCourt said that I was welcome back to the clinic any time, even if it was just for a short break from school, and maybe even he'd pay me next time. But it was definitely reassuring to me that I had a job open for when I get my license, and even when I graduate from Delhi, and if I end up living in the area.